Hi, my name is Monique Howard. Today I will be discussing the 5 touch points of a patient's journey. Today's lesson objectives are: at the end of this lesson, you will be able to do the following: identify 5 touch points of a patient's journey, map the patient's journey during a clinic visit, demonstrate effective communication technique, learn a process for handling difficult patient issues. 5 touch points of a patient's journey includes scheduling, parking, elevator, information, and the check-in process. During these journeys, you would learn and demonstrate effective communication techniques, handling difficult patient issues, increase customer satisfaction, map the patient's journey throughout the hospital, and create an excellent customer service experience. Our first touch point is scheduling. During the scheduling, we want to make sure that patient, when they call to make that appointment, that you have that friendly smile on the other phone, because the patient can feel that warmth. We got to remember that our patients could be included, our family, our colleagues, our friends. Our next touch point is parking. We want to make sure that we have that correct signage telling us where the parking garage is. We know that sometimes we may come across some issues such as no spaces available, valet wait time, someone pulled into the space, feet got wet in parking lot, it was a rainy day, had to park far from the elevator, patients double parking, employees not using dedicated parking area. Elevator, our next touch point. Always allow people to get off before you try to get on. Make sure your patient ride first, even if it means you're late. Hold the door. Smile. Miss Betty is here also to help. Information desk. We want to make sure when that patient steps off that elevator and they're looking lost, we can point the patient to the information desk. We want to make sure on that information desk is included maps showing the patient how to get to internal med, how to get to the clinic. Okay, patient transport. If our patient is seeing or having a hearing impaired or need an interpreter, we need to know that. International department. If the patient is having a language deficiency, we need to have the interpreter on file with those hands on numbers. Our final touch point is check-in. We want to welcome our patient. Inquire our patient needs. Use the patient name. Consistently use patient identifiers. Handle transactions professionally. Direct patient. Additional needs. If the doctor is running late, we need to come out and let the patient know. Withhold judgment. When the patient walks up to the desk, do not make comments about the patient. That is not good. Keep patient informed. As the patient exits out of the doctor's office, we want to give them a big, fine farewell. We impact the patient experience in these 5 areas: scheduling, parking, elevator, information, and check-in. I challenge you to tell me how can you improve one of these areas: scheduling, parking, elevator, information, and the check-in process. Thank you.